Today we are going to learn how to read a fracture on an X-ray. This is the first part of the lecture series. Here we are going to learn about the fracture pattern. Now a fracture could be defined in a lot many ways. The simplest of definition would be that a fracture could be defined as a partial or a complete break in the bone. The most common modality for diagnosing any fracture in a hospital would be X-rays. Now, once we have to order an X-ray, it is always neither simple, as a single X-ray will not be able to tell us about the complete uh, the pattern of the fracture. So we have to get at least a minimum of two views. Hence, we have the rule of twos. So, in the first rule of twos is two views, that a minimum of two views. The most commonly that is prescribed would be an AP and a lateral view, and sometimes we add an oblique or special views. Then we have the rule of two abnormalities. That is, if you see one abnormality, always look for a second. Then two joints. Always X-ray one joint above and one joint below the fracture. Then two sides. Sometimes once there is a diagnostic dilemma, especially in pediatric elbow fractures, one could get X-ray of the opposite side to compare the two X-rays. Then two occasions. Always compare the current X-ray with the old X-rays of the patient if they are available. Then two visits. Always the patient is asked to come in follow up after some time so as to repeat the X-rays. Then two opinions and two records. Always when in doubt, never hesitate to ask from a senior if you're not sure about the diagnosis so that you could record your findings. Then two specialists, one from the field of orthopedics and one from the field of radiodiagnosis. So the opinion of both can be sought in a diagnostic dilemma. Then two investigations. Nowadays, in addition to X-rays, a lot many times we seek the help of a CT scan. For example, in spine fractures, in pelvis fractures, and periarticular fractures. Sometimes we also make use of ultrasound and MRI to aid in our diagnosis. So these are the rule of twos. Now the fracture could be classified either as a typical fracture or as an atypical fracture. The typical fractures could be further subclassified as linear fractures, which are caused by low velocity energy fractures. They are low velocity energy fractures in which we have transverse fracture, oblique fracture, and spiral fractures. And when once the high energy fractures are the high energy fractures would be the comminuted fractures, the segmental fractures, and fractures with bone loss in increasing order of the severity of the high velocity injuries. Comminuted fractures could also be classified as either the comminution is less than 50% or more than 50%, and the butterfly fractures are also subclassified as comminuted fractures. Fractures with bone loss could also be classified either as less than 50%, more than 50%, or in a case of okay, or sometimes with complete bone loss. Atypical fractures that we are going to discuss would be bending fractures, green stick fractures, stress fractures, pathological fractures, and torus fractures. So we start our first X-ray with a transverse fracture. They are low velocity injuries and one of the most common linear fractures that we may come across in our clinic. Here one can see that the fracture makes an angle with the horizontal, and this angle that is made with the horizontal is less than 30 degrees. It occurs when the bone is broken perpendicular to its length. The fracture pattern is a straight line that runs in the opposite direction of the bone. It can happen to any bone in the body, but usually it affects the long bones like femur, like tibia, like fibula, like humerus. Usually it is seen after trauma like a fall or an accident. Here is another X-ray showing a transverse fracture. The previous one was an undisplaced, here it is slightly displaced. Now the second of the fractures that we may come across would be an oblique fracture. An oblique fracture is caused by a combination of compression and bending, and it makes an angle of around more than 30 degrees with the horizontal. Here the angle that is made between the fracture line and the horizontal would be more than 30 degrees. So an oblique fracture is one that breaks diagonally across the width of the bone and along the longitudinal axis of the bone. Because of the shape of this bone, the edges of the bone are typically quite sharp. Here the edges would be typically quite sharp and knife-like, and such edges could cause laceration to the skin over the fracture, causing it to become a compound or an open fracture. Then we have the spiral fractures. Here you can see the spiral fracture. The spiral fractures uh, is that the break spirals around the bone. It is common in a twisting injury. They happen when the bone is broken with a twisting motion. They create a fracture that wraps around the bone and looks like a corkscrew here. Then we have the the butterfly fracture. It is a combination of a transverse and an oblique fracture with a butterfly fragment. This is the butterfly fragment, and one has to address this fragment as well. Then we have the comminuted fracture. The comminuted fracture is caused by a high velocity injury. It is one of the fracture in which the bone has broken into three or more pieces and fragments are present at the fracture site. It would be characterized by breaking of the bone into several small pieces. Here we can see, and is always a result of high velocity injuries like car accidents, fall from a height, or high energy injuries with tissue loss caused by the fragments from the fracture. Then the next fracture that we could have would be a segmental fracture. A segmental fracture is one where there are at least two fracture lines. Here we can see this is the one fracture line and this is the second fracture line. And because of the two fracture lines in the bone, one can see a segment. This would be the segment of separated bone in between the two fracture lines. A segmental fracture is typically also caused by high energy impact, such as it could occur in a road traffic accident or being ejected from a vehicle or falling from a height. Then we could have a fracture dislocation pattern. Here there is an elbow dislocation along with the fracture of the distal humerus. Sometimes we get to see a fracture like this, in which there is a segmental fracture of the fibula here, and we have a fracture of the tibia as well as a fracture of the distal femur. Such fractures are called as floating injuries. Here, because the knee joint is involved, the fractures are above and below the knee joint. So this fracture pattern could be called as a floating knee. Similarly, we could have a floating shoulder, a floating elbow. Here, this is a high velocity injury in which there is there happens to be a bone loss in the distal femur. So these are fractures with bone loss, and depending upon the amount of bone loss, it could be either less than 50% or, as in this case, more than 50%. Then there are certain group of fractures which are called as avulsion fractures. These avulsion fractures, they occur when a small chunk of bone which are attached to a tendon or a ligament, they are pulled away from the main bone. For example, they are seen in the hip, the elbows, and the ankles. For example, in this X-ray, the medial epicondyle is avulsed because of the attachment of the common flexor origin. So these would be an avulsion fracture of the medial epicondyle. Similarly, we can have an avulsion fracture of the calcaneum because of the strong pull of the gastrocnemius. So these are avulsion fractures. Then we can see an incomplete fracture of the femoral neck. So now we are talking about the atypical fractures. This is an incomplete fracture of the femoral neck. This would be a stress fracture. The stress fracture here is probably because of a malunited shaft of the femur fracture that has malunited in varus, leading to a stress fracture of the neck. Similarly, these stress fractures, they are they could be seen as a tiny cracks in the bone, and usually they are incomplete fractures which are commonly seen in athletes and in bones which are subjected to chronic and repetitive stress. For example, they are most commonly seen in the foot, in the metatarsals, or it could be seen in the tibias. They're most commonly seen in military personnel or in athletes or ballet dancers. Then we have another type of fractures which are called as pathological fractures. The pathological fractures, here you can see this, the pathology underlying is a unicameral bone cyst or a simple bone cyst, where here we can see a pathological fracture. A pathological fracture, it occurs through areas of weakened bones attributed to either a primary malignant lesion or a benign lesion or metastasis or underlying metabolic abnormalities, with the common factor being an altered skeletal biomechanics secondary to the pathological bone. So this is a unicameral bone cyst with a pathological fracture here. Then in the pediatric age group, we have certain set of other fracture patterns that we usually see. So this would be a bowing fracture or a bending fracture. So here we can see that the curvature of the ulna is excessive. It would be very difficult to appreciate this, so we may need a comparative x-ray of the opposite side. In the lateral view, it's everything is fine, but in the AP view, here you can see the curvature of the ulna being excessive. This represents the bowing fracture of the ulna, and it usually is seen in the forearm of children, and the this is commonly seen in children as a bending deformity without a grossly visible fracture in the tubular structure of the bone. Now, microfractures on microscopic examination could be seen, but only the bowing is appreciable on the x-rays or clinically. Then you sometimes see that children who have a fall on an outstretched hand come with a pain and swelling around the wrist. Once an x-ray is taken, you see a torus or a buccal fracture. Now, a torus or a buccal fracture, they are also incomplete fractures of the shaft of a long bone, which are characterized by bulging of the cortex. Here you can see the bulging of the cortex. They result from a trabecular compression due to an axial loading force along the long axis of the bone, for example, falling on an outstretched hand. They are most commonly seen in children in the distal radial metaphysis. Now, the term torus, it is derived from a Latin word meaning protuberance. Now, in the Greek architecture, it resembles the appearance of the column of a Greek architecture here. The base, there would be a base, there would be plinth, and the third thing that is here is the torus, and followed by the body. This is the architecture of the Greek pillar. So this part of the Greek pillar is called as torus, which from which the the term is derived for this fracture. Now, we in children, the one can also see green stick fractures. Here in these green stick fractures, you can see these are incomplete fractures in which there is a partial thickness fracture only where only one cortex and periostem are interrupted. For example, here the volar side is interrupted while as the dorsal side is intact. Green stick fractures occur most commonly after a fall on an outstretched arm. However, they can occur also due to some other type of trauma, including road traffic accident or sports injuries or non-accident injuries, where the child is hit with an object. So the simple way to learn a green stick injury is that where one cortex is broken while as the opposite side bends. So this would be a green stick fracture. Now in children, if the fracture is complete, it could be a complete fracture. Here you can see both the cortices are broken, and in children we can also have fracture dislocation. Here there's a fracture of the ulna with dislocation of the radius. This would be a Montegia fracture dislocation. Hope you enjoyed the video, and thanks for watching.